You're listening to the Yoga Medicine Podcast. I'm your host, Tiffany Cruikshank. Our podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts, Rachel Land and Katja Bartsch, as we dive into all things yoga, research, and wellness. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs. Welcome to the podcast. I'm here with Katja today, and I'm so excited because we are talking about the placebo, what it is, why it's so incredibly important, and how that applies to so much of our lives as humans, as yogis, as yoga teachers, and probably so many other parts of our lives you'll see as we go through this. I know I've been so enthralled by the placebo effect, and Ted Kapchuk is someone who's done a lot of research, and I'm sure his name will come up today. A lot of research on placebo, and he's kind of an icon in Chinese medicine, has been for a really long time. So he's someone I look up to and really admire all of his research. And so I'm really excited to have Katja here to really dig into it from a scientific perspective and then bring us some takeaways that we can use and apply. And I think you'll find there's so much in this episode that will apply to your life, whether you even practice yoga or not. So, Katja, I'm excited to have you. Welcome. It's nice to see you.
Welcome, everyone. Excited to be here. Yeah, so I'm excited about the topic too. I mean, you just mentioned it. The placebo effect is in so many aspects of our lives, and it's really about expectation and about how expectation can influence so much of our daily experience, be it in yoga or not. And we'll see that hopefully throughout the episode. It's really fascinating. You may have heard about the placebo effect in medicine, but there's so much more to it. We'll hopefully talk about how it influences your food intake, your exercise, and all of these things. So it really is a fascinating topic, and I hope we get to dive into all of that.
All right. Well, we're ready. Let's dive in. I want to hear all about it. And I know you have a lot to say. So tell us a little bit about what it is and a little bit of the background on it, so those who aren't familiar can understand a little bit more.
Yeah, so I guess many people have heard about the placebo effect. We typically think about it firsthand when it comes to medicine or the realm of medicine. And there it's known as like a sham drug or a sham treatment. And that's why some people still have like a negative connotation with it. Mm-hmm. But it's actually much more. We'll see that it will relate to how food is labeled or how exercise is labeled and stuff like that. So it's about how certain medications or certain products are being presented to you and what kind of expectation that invokes in people. That's what a placebo is generally.
I love this part of it too, because for me, it's kind of demonized in Western medicine. The placebo is kind of like, the part of it that is, what we're trying to eliminate and get rid of so we can prove that our medicines work. And it's really interesting from a different perspective, I guess. From my perspective, I really think of it as, the power of the mind in many ways, because it really does look at what's happening outside of the context of the medicine, the potential that the mind and the body has to heal itself. And I think it's such an interesting thing to look at. So,
yeah, definitely. And fortunately, research has picked up on that. And it's not only about proving that a medicine works anymore. It's really also about finding out about the positive effects that placebos can have, even in medicine. Like you could lower your pain or your depression, your anxiety just by receiving a placebo pill. So fortunately, and Ted Kapchuk that you've mentioned already is one of the icons there, among others, who have directed their research into those positive effects of placebos and how we can harness them for our daily lives too, or also for medicine, of course. And I think that's so exciting that we now look like, how can we actually make use of placebos and their effects?
Yeah, and get rid of some of those nasty side effects with the drugs potentially, maybe as well.
Yeah, that too. I mean, we also have to say that placebos, and we'll hopefully talk about that too, they can also invoke negative consequences too. So we also have to keep that in mind. You can also worsen side effects or symptoms by placebos. That's the case as well. But yeah, the positive effects have been proven in many different scenarios now.
So talk about that. I think there's also a name for that as well, right?
Yeah. So that would be like that worsening of symptoms or evoking of symptoms. We would call that a nocebo. It's less well studied than the placebos, but for instance, allergies or stuff like that can also increase when you receive a placebo and you're being informed that this placebo or say a cream for a rash will maybe increase your immune response to the rash. Then that could increase that, or you could have a more severe allergic reaction to that too. So fascinating as well, not as well researched yet.
So these are patients who are being told what some of the side effects could be, and they're experiencing some of those just being on the placebo.
Exactly. And that what you're mentioning, that being told about a placebo, that's a lot or a big part of the component how a placebo actually works. So it's usually not the pill that you get that actually works. It's the expectation that is being evoked through communication, through the social context that you receive that pill from, like how is the doctor talking to you, stuff like that. So that part, how medication is communicated, and that will also be relevant maybe to the yoga context, that all plays into that expectation, that plays into that mindset that you have about a certain treatment. And that will be the way how the placebo actually works, that expectation that arises within you through communication, through prior experiences with a substance or with a certain treatment, for instance. Yeah.
So tell us a little bit about the history. I mean, I know this has been around. I mean, it seems like such a new topic. Obviously, it's been around for a long time because we've done research for a long time and it's been part of it in that context. But the study of different types of placebos and the history of it, tell us a little bit of background.
Yeah, so I think the term itself has been used for a couple hundred years, since the 1700s or so. But it's really been the last couple decades that it's been in the focus of research. In the time of the world wars, there have been a couple of really interesting placebo studies related to pain treatment with morphine. So soldiers didn't get morphine, they only got a saline solution, for instance, and they still got better. That was kind of like the early days.
Wow.
Where placebo and pain was being researched. And now, since the mid 90s or so, there has really been an increase in research. And one very, very prominent name that you've already mentioned is Ted Kaptchuk, who's at Harvard. And there's also a big group in Stanford, but really all around the world, in Germany and Italy, there's also big labs that focus on placebo research. And in the last 10 years or so, there have been even more articles on that, even more scientific papers on that. So it's really an up-to-date topic, I would say.
That's so interesting. I had no idea about the morphine and the war. I mean, what an interesting thing. You know, I really believe that something good always comes from the bad things, right? Everything is all interconnected. And what a beautiful thing to find in the midst of something not so beautiful, not so wonderful. Yeah. Huh. I love that.
Definitely. I mean, if we want to add a fun fact or not so fun fact about it, is that the person who was researching this, his name was Bleacher. He later was found out to work for projects with the CIA and then also with concentration camps in Germany. So wow. He's a little bit, he had some criticism that arose later too. but still that part of research kind of kicked it off in many aspects, and it's still so much worthwhile. Yeah.
I mean, but that's such a powerful thing to think of someone. I mean, I'm picturing in the war, someone having their leg blown off or something really extreme. To me, a lot of times we associate placebo with, like these really subtle changes. Like, I think I'm feeling better. I mean, that's a real change. These are people who are experiencing some severe pain, who really needed morphine, maybe another discussion on the opioid crisis at some point, but like these are people who really needed that morphine and were able to benefit from saline solution, thinking it was morphine. I mean, that's powerful, I think. When we think about the potential of our minds to be able to see us through such extreme circumstances. So
Totally. It really teaches you something about the power of the mind, doesn't it?
Yeah. Now, I think there's different types of placebo, right? So, and I'm familiar a little bit with that from the acupuncture world. I know it's very controversial in acupuncture, this idea of being able to do like sham acupuncture, which, is kind of a hard thing to wrap your head around, even if you've never had acupuncture. This idea of, are we inserting needles? Are we not inserting needles? Are we touching them? I mean, everything is having an influence on the body. So it's pretty challenging, I'm assuming, to come up with some of these sham treatments or placebo treatments.
Yeah, I think it's a little bit more easy if you want to give someone a substance like a pill. There you can decide, is it like an active placebo, we call it? That would be a pill that contains a little bit of an active agent. Say you want to study something about smoking, about nicotine patches, you would still add like a teeny tiny little bit of nicotine in there. So you have the smell, you have the odor, and the person is still convinced that there's something in there. So that's one type of placebo pills where you actually put a little bit in there and the person is still convinced they get something. But there's also other studies or other medical applications where you give someone a pill and there's no real active agent in there. Say they give you a vitamin and the condition we're talking about doesn't have anything to do with a vitamin deficit, for instance. So those you can do, that's with pills. It's a little bit more easy. I think what's really exciting, it's not done that much anymore, but it has been done in the past, are sham surgeries. So someone who would,
I know.
yeah, they would cut you up.
Not totally ethical, but
so that's why it's not done anymore. Yeah. Actually, you wouldn't be able to get the ethics approval for a study like that anymore. But in the past, it has been done. So,
but if I could choose, I would choose the sham one. I mean, especially if it made me feel better, right? I mean, that's the interesting thing, is they were getting just an incision and no surgery and feeling great. And I mean,
exactly.
If I need surgery, sign me up.
Exactly. Just do the cut and then sew me up again, and you're feeling better. Yeah. So that's not being done anymore, but it still teaches us a lot about the whole power of mind again. So that's like the medical application of it. It's a little bit harder, to be honest, for our applications, maybe like movement therapies or manual therapies. It's harder to really define a sham there, because let's face it, if we want to study a placebo effect of yoga, you will know whether you do yoga or not. So to some degree, at least.
And what's interesting here too, that makes it more complicated, is what the people listening might not know too, is that usually in a good study, they're also collecting information about what the participants think they're getting, which is really interesting as well, because, sometimes participants are talking to each other, or, if they do sham acupuncture where they're just taping it on or doing something where they're not inserting a needle and they're talking and someone's getting it and it's painful and there's like, oh, mine doesn't hurt. Oh, then they might make, they sometimes can put two and two together and find out that they are the placebo. And then that obviously influences the outcome. So, and it's really interesting, I think, with acupuncture, because, if you're inserting something, so a lot of times they're inserting it in what they call non-acupoints, but if you look deeper at acupuncture, like Ayurveda, this idea of having nadis or energetic channels over the body. In Chinese medicine, it's the same. We have the main meridians, but there's energy channels everywhere. So, even inserting a point and a needle into a non-point, many people believe still has an influence on the energetic system. And then, if you don't insert it, even just having their attention at that acupuncture point can maybe bring about some changes. I know we use this a lot in our trainings too. I always say, like, you don't need a needle to influence the points. You can use acupressure. Even just bringing your attention there is a way of shifting energy in the system. I mean, they're all doing it in different ways, and but I think influencing it. So it's really challenging in an acupuncture setting to come up with a sham, and in yoga potentially as well, because then if you want a double blinded study, right, the person giving it, like, now your head explodes. How do you do that with yoga?
Exactly.
Which is the gold standard, right? So
yeah. And it's the same in manual therapies. I'm working on a study where I'm thinking about these things currently for our setup, and it's really hard. Also, like you're mentioning with acupuncture, once you touch someone, that is going to influence their nervous system. And then starting to think about what kind of touch you apply and how that weaves into it all is really, really hard to be precise, and it's really a challenge in setting up studies. So it's a little bit easier maybe with the pills, but with those things it's really a challenge to find a good setting. Yeah.
Well, and the double blinded is really the gold standard, right? And if you think about that in any setting, yoga, manual therapy, acupuncture, if the practitioner doesn't know what treatment they're getting, right, the practitioner still has this intention of healing them, which is a whole nother topic, might be beyond what we're talking about today. But, I really believe that, I think we'll probably touch on this a little bit, but I really believe that our intention has an impact on the body as well, which is now a really challenging thing to bring into the equation as well.
Definitely. Yeah. And it's gonna tie back also into how you talk to someone, and is that going to be influenced by your intention? So it's not the application of the thing, of the touch, of the movement. It's the whole setting around it, how you're gonna talk to people, how warm you are to them, how competent you're gonna seem to them, and all of that stuff. So it's a whole package.
It's complicated.
It is. That's why it's so interesting.
Oh, I love it. So tell us a little bit more about how placebo is used in medicine, and its importance, and any other background information you think is important for them to understand.
Yeah, so I think just to venture out with that again, it's really important to stress again that it's typically not the placebo itself, the pill itself, that is going to lead to an effect, but it's the expectation that you have when you're being treated with a placebo. And that typically foots in or is based on, of course, also your body's ability, your body's own ability to heal. So that can always be a part. We're not going to talk about that one so much, but your expectation is also very much going to be influenced by your mindset, by what you've experienced before, what you've been learning about a certain therapy before. And it's also going to be influenced, and I've mentioned this already, by the context, by the social context that you receive a placebo from. Like how is the person treating you? How are they talking to you? Do you consider them to be warm? Do you consider them to be competent? What does the room look like? All of these things. So let's keep that in mind when we look at the different applications, or at a couple of examples. We always can tie those effects back to those three things: the body's innate ability to heal, and then the social context, and then also your mindset. And that will create an expectation that you have around a certain placebo effect, and that will actually lead to the effect probably. So yeah, we've already talked a little bit about a couple of studies. And in a study, it's always a little bit easier. You can give someone a placebo and that will be okay. You got your ethics approval from a university and you're fine. But let's say you're an acupuncturist, or you're a caregiver, or you're a yoga teacher, and you want to give someone a placebo because you're convinced that you can harness its effects, it's a lot harder then. So that's considered to be unethical. So you shouldn't do that. So you shouldn't, like Tiffany as an acupuncturist, you shouldn't just give someone,
not give them needles.
Not
you pay me and I just
needles.
not do.
Yeah, without letting me know.
Yes.
So letting me know would be actually one option to go around that, and that's one like super fascinating aspect of placebos to me. So in clinical practice, one way that is actually under focus right now is open placebos. So that would be one way to, in clinical practice, to be ethical about placebos. You tell someone, this is a placebo. It is still going to help you because we know that placebo effects can help you with your symptoms. And you take that placebo knowingly that it's a placebo, and you will still improve. Your symptoms will still improve from that. So that's one part of research, and one thing that's absolutely fascinating to me is that research about, we call them open label placebos, that's still in its infancy. Again, you've heard the name by now a couple of times. Ted Kapczyk from Harvard has first shown this in 2010, I believe, and there's a lot of ongoing research. And giving open placebos can help with many things, with chronic low back pain, with depression, with irritable bowel syndrome. So we do have studies on that now. And that's one absolutely fascinating way for me to ethically give placebos in clinical practice.
That blew my mind when I learned about that a few years ago. I was like, wow. And supposedly you can get these on Amazon and different colors have different effects, right? I think the blue or the purple pills are more calming and the red are more associated with stimulants or energy. Sorry, not exercise. Exercise is energizing, but that, like, obviously there's a lot more to it, but that there are even different colors that influence, what they're used for, but that the patient actually knows that they're getting placebo that blew my mind.
Yeah. Again, we don't really understand how that works at this point, but apparently your mind will still have some effect from the interaction with the person who's giving it to you, or just from your prior experience. The red pills have always done this and that to me. So yeah, it's we if you want to say it in another way, we can really trick ourselves in a good way. So yeah, it's that part is absolutely fascinating to me as well.
Love that.
Yeah. And there's also other ways. So you could, as I said, you could in clinical practice give someone an open label placebo, but placebos are also used sometimes in a different way, or the placebo effect, should I say, is used in a different way. You've mentioned the opioid crisis, and that's a big one, or a big context that this is being used within as well, pain management or pain therapy. So if I would administer, I'm not a doctor and I won't, but if I would administer a certain pain medication to you, and I would very much stress the positive outcomes you can expect, the positive effects, the impact of the drug, just that conversation about it can evoke those positive expectations. And that positive expectation can lead to your own body opioids being released. And that in turn can help for you to reduce the dose of the opioid, for instance, you're using. So by evoking those positive expectations, for instance, through communication, through that social context, we can help patients to need less of a certain drug. And with some drugs, that's an extremely positive thing. And then they don't need as much of that drug anymore. And that's also considered to be a placebo effect, because the placebo kind of amplifies the drug effect, and you won't need as much of the drug anymore.
I think about this a lot in our teacher trainings because we train our teachers so deeply. I mean, they get, sometimes 1,000+ hours in training. And sometimes I think about it and I think, obviously there's something really powerful to what they're learning and the actual applications. But I also think that a big part of it is that from what I see in our teachers, it really changes how they speak to their students and their classes. They feel more confident. They're able to explain things better. And for me, it kind of creates what I think of as this healing map, so that the person who they're working with now is picturing a little bit of what's happening and that road back to. Now, I think the caveat here that's challenging is, as a yoga teacher, we need to be careful to not give absolutes, right? And have our language open enough that, we're not giving them obviously diagnosis or treatments in kind of that medical context, but to be able to guide them along these healing journeys and guide their expectations, I think is such a really powerful thing. And it does take, I think, a little bit more understanding of the body to be able to have those conversations. I remember too, I think there was a study I remember seeing at some point where, I mean, maybe there's been several on this, but looking at people who are given pain meds by a doctor versus by a button, where they actually get more relief when the doctor comes in and asks them how they're doing and has that interaction, that caretaker's role, which is really, I feel like as yoga teachers, that's a big part of our role. I mean, like much like a nurse, like we're there to really spend time with them and get to know them and be able to guide them and support them, not necessarily have all the answers, not, to administer the medications, obviously, but we have our own form of that, of course. And I think the placebo is a really big part of that. So I think that's really cool. I love that you mentioned that part of it too.
I fully agree. And I actually think that's one of the major takeaways that we can transfer maybe from that medical realm to the yoga realm as yoga teachers, is that communication and how we're speaking to people, how we're listening to people, also our nonverbal cues, how important that is. And there's been surveys in the US. A doctor typically interrupts a patient after 23 seconds. So you get to say hi, and then my problem is, and then basically on average, of course, you're being interrupted. And it just, with all these studies, it has been shown that empathic communication, that warmth someone is showing you, the listening, that really does have an effect on treatment. And we can absolutely translate this to the yoga realm, to us as yoga teachers, I think. And also doctors are now being trained more in communication than before. And I think it's just the same with yoga teacher trainings. We should also really stress how important our words, our cueing, our nonverbal cues are in our setting, and how much of an effect that can have. So yeah, I absolutely agree with you.
I love that you said the listening too, because I think that's a really big part of that. I often, when we go through, when people are in our programs and we talk about going through an evaluation, that's often a big part, I mentioned too, is, part of it is, that therapeutic aspect of listening. Many of our students, our clients that we work with have never been truly heard, and there's a lot more to the system. So it's not all on the doctors, right? Like they're trying to get through all of their, their workload, and they're dealing with the insurance and a million other things. And so, I think part of it is the system, and that's, a lot longer conversation, but they're only spending a few minutes with the patient potentially, depending on the circumstance. And so, what's beautiful about our interactions is, our job isn't necessarily to have all the answers, right? It's definitely not to have the answers as far as diagnosis goes, but it is to be a compassionate listener, And, I think placebo shows us just how important that part of it is, because it's easy as someone, and I think this applies to non-teachers as well. It's easy as someone who's listening to think that listening is just a passive thing that we do, but we don't realize that listening is actually serving a therapeutic role, whether you're actually working with a client or you're listening to a friend. I think those moments of really compassionately listening and empathetically listening is such a valuable service to the person that we're interacting with too.
Yeah, it so much is. And I think it, as you're saying, it's not only relevant for teachers, also in our day-to-day lives. It's about that mindfulness that we have in our social interactions, being it about listening or what words we choose if someone approaches us with a problem. Maybe I can tie in a little bit of the nocebo research at this point. For instance, there's research that women who are in labor and about to get an epidural, they will experience the pain differently depending on what words the nurse chose before. So if it's like, oh, okay, this is going to sting, this is going to burn, and that's going to be the worst part of the procedure, those women, they really felt more pain than other women who got a little bit more positive announcement, like this is going to help with the epidural, we're going to put a little local anesthetic there, it's all going to be good. Like those positive effects of that treatment, like how you put that into words is going to influence how someone's experience is. And I mean, that's again a medical example, but I think it also applies so much how mindful we are with our words if someone approaches us with a problem, with something they need advice on. So it really is about mindfulness as well, in my opinion.
Our words matter.
They do.
Yeah, I love that. Well, let's talk a little bit more about the mechanisms behind it. If you want to share with us a little bit more behind it, and then we'll dive into some more of the applications and takeaways and things.
Yeah. So I think what is really important to say is that there are not only those expectancies that we have that change, but you can also measure things in the body and in the brain. That's the first thing. So there are mechanisms behind the placebo effects. So your expectation evokes some sort of response in the body and the brain. And one area where we know quite a lot about is, again, pain. Like we said, in the early days, pain was already researched in the world wars, but we also now have a couple of studies on opioids. Again, quite recent or relevant topic with the opioid crisis potentially also. So we do know that if someone is administering a placebo pill and they give you that positive information and they evoke that positive expectation, that your body will actually release its own opioids as well. So you will help the opioid system by producing your own opioids a little bit more. And that, as I mentioned before, can reduce the dose you actually need of the medication. So that's one thing. Your body actually produces certain substances just because you have that positive expectation. That's a crazy thing to me, but
there's a real physiological process happening.
Measurable things. Yes. And then we also know that receiving placebos can generally change your pain pathways. So it can kind of deactivate the parts of the brain that trigger a pain response. And it can activate the parts in your nervous system that kind of down-regulate pain. So that has been shown with different methodologies, and it's measurable. So it's not something that we just think about. You can measure that.
Well, and pain's a really interesting one. I think, at some point we'll do a whole episode or maybe several on pain, but
yeah,
because it is something that's actually being processed in the brain. We think of that mechanical stimulus that's being the painful it can be the instigator, but the pain response is actually happening in the brain. It's our interpretation of it. So I think these placebos are so interesting for pain, especially chronic pain. And then even acute pain. That was really interesting to me in the war. But yeah, because it's actually happening in the brain, why not go right there?
Yeah, and we also know that if the communication in the brain is altered, like with Alzheimer's disease, where your more frontal areas of the brain cannot communicate with the deeper parts of your brain anymore, no placebo effects can be detected. So we
Wow.
definitely know that it has to do with brain anatomy and how the communication is structured in the brain. So there's definitely a correlation there, and a way to go, especially in pain treatment. Yeah.
Wow, I've never heard that one before. That was really interesting.
Mm-hmm. Yeah, so the brain related to pain therapy is one mechanism we know quite a lot about. There's also some information that your genetic disposition might influence how much or how strongly you experience placebo effects. There's, for instance, related to irritable bowel syndrome. There was a study that looked at certain enzymes, and those enzymes had to do with the signaling of dopamine, and again also of opioids. And people who had a certain specific variant of that enzyme, they had stronger placebo effects. So your genetic predisposition in some areas can lead to you experiencing a stronger placebo effect. That's pretty new too, and we don't have tons of research on that, but certain parts of your genome might also influence how you experience placebo effects. I find that fascinating.
That's really interesting. Yeah, I didn't realize. That's new to me. That's super interesting.
Yeah, and then maybe a third mechanism we could talk about is related to your immune system, actually. So we have a couple of studies that look at people who need to take immunosuppressants. So people who got a transplant. I know of studies with kidney transplant patients. They need to be on these medications that have really severe side effects. And again, in those studies, people still get their medication because it would be very unethical not to give them their medication.
Yes.
But with the placebos, they were able to reduce the doses of those medications, which for those people is an immense improvement in their quality of life. And it's just very good. And you do that through conditioning, through learning. So in that one study, I think it's a German study, they created kind of a new taste. So they created some sort of strawberry drink in a very weird color, I think blue strawberry or something that your brain didn't recognize before. And they told people that this is a new medication that will lead to an improvement of their immune function related to the transplant. And they drank it, and over time, the body learned that this specific taste would have or is related to the medication. And then at some point, only the taste itself, that learning process itself, helped to reduce the dose of that immunosuppressant. And what happens, or what we can see, or what was measured, was that learning process formed new connections in the brain. That's one thing. And then that new information or that new connection is being signaled or transferred through the nervous system, the sympathetic nervous system, to your immune cells, to your immune organs, and they then respond. So a new brain connection from learning a new taste can be transferred through the nervous system to immune cells, to immune organs, and can help you to having to take less of a medication. And I find that fascinating too.
Which is a huge deal. I remember, I think it was Irving Kirsch who works with Ted Kapchuk at Harvard. They're doing all of their placebo studies. I think it was, I want to say it was his book, The Emperor's New Drugs, where he talks about that. And and a lot about the antidepressant and placebos, antidepressants and placebos, which is really interesting. But when I first read about that, that was pretty mind blowing to me too. I mean, I think that's a big deal when someone has an organ transplant to be able to start to bring down their dosage of some of these crazy powerful drugs that have pretty extreme side effects is a big deal. And so not just language matters, but smell matters. All the things matter. All the like proof of life, right? The proof of medicine and the
A little
artifacts.
caveat though, we can experiment without words, but if you're a kidney transplant patient, please don't
Yes,
experiment
thank
with
you.
the dosage of your
Yes.
medications under any circumstance. These are controlled studies with medical experts. We're just referencing them. We're not encouraging you to
Yeah,
experiment with those things.
and I think it's interesting too as a patient, you think about these things, and for me it's kind of a challenging thing because sometimes I'll get like frustrated with the way that people interact with me, medical doctors, or things they tell me. And I think the place that we can intervene is by choosing a team of healthcare providers that we really believe in and that we really enjoy, whether that means they spend a few extra minutes with us, or maybe it's a functional medicine doctor who sees things, in a more holistic way, or someone you just kind of jive with. I do think, we kind of think about medical doctors as just like you just go to the person who's on your insurance near you. And I know this is a different conversation in different countries. But I do think it's important to find a practice, whether we're talking about acupuncture or massage or surgeons especially. I think that's what I always say in our courses. If someone's unsure about their medical care, I am never, as a yoga teacher, going to tell them not to take a medication or to take their medication dosage down. I mean, that's a really important thing. Like, that's not our job. But what I will do is encourage them to get a second opinion, not tell them that what their doctor said was wrong or bad, or even have that tone, right? Like, I'm really careful with my tone and trying to keep things in that light that we've been talking about, which can be challenging. I think, we can get too in our heads about our language, but what I'll do is just encourage them to follow their gut and get a second opinion. And a lot of times, that might just reinforce how much they like the first doctor, which is great because now and surgeons want that. Surgeons want great outcomes, right? So they usually want the patient to be really on board and confident with it. And so I think it benefits everyone to, sometimes it takes just a little bit more work on our end as a patient to find the right person, which can be frustrating and tedious, to look around and try all the people. But I do think it's worth it for all of these things as well as many others. So
Definitely, especially, I mean, as a patient, it can be challenging, especially if you have a condition that you personally don't know a ton about and you don't want to play Google MD, and then you have to rely on the people you're working with. But I absolutely agree that gut feeling is important, and it is a big part of your expectation. And it's not everything, obviously, but it's one part we shouldn't neglect. Definitely.
yeah. And the Googling, I mean, this is probably a whole other topic, but the Googling can take us down a road, which, like, you can Google things and learn some, but if you don't have the whole context of medical school and everything that the doctor can provide, sometimes we don't see what we need to see. So it can be a dangerous. I do really think it's important to be a proactive as a patient. Like, I am the one invested in me and my outcomes, and I'm ultimately the one that has to decide, am I taking the pill or doing the surgery? But it's the doctor's job to give me all of those things to weigh out the pros and the cons, right? And the benefits and the side effects. And um, so yeah, I mean, a little off topic, but I think, finding someone that you trust, because ultimately we are trusting someone's, it's still an opinion, because if you go to different doctors have different opinions. It's not just like everyone's going to tell you need this surgical procedure usually, or this pill usually. And there's a lot of different ways to go about health and well-being, especially when we talk about health and well-being rather than, emergency procedures, which is a little bit sometimes more clear cut.
Yes.
Save their life.
Definitely.
Thanks for listening to Yoga Medicine. If you like the show, please be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com, or check us out on social media as Yoga Medicine. You can also email us at info@yogamedicine.com. Thank you for being a part of our Yoga Medicine community. We look forward to seeing you again. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.